Advancements in technology have created a disconnect in how we interact as humans, and face-to-face communication in healthcare is no exception. Electronic access empowers shared decision-making, but adds a burden of interpretation to people who do not have medical training, especially in marginalized populations. This threatens patient-centered care, which should consider patient values and works in tandem with clinical evidence. Breakdown in communication leads to adverse events, decreases patient safety, and threatens the welfare of team members. Informaticists who develop practices for acquisition and processing of health data must work to ensure that advancements in tech do not outpace patients and provider capabilities. EHR should include a patient-driven empower list alongside a problem list so that a patient-specific goal or value is visible at the center of their care. In creating treatment plans, machine-based learning algorithms have proven effective in enabling patients to make individualized choices in areas like breast cancer treatments and smoking cessation programs. We can collaborate with patients to create culturally sensitive care evaluations. Informaticists can validate these tools and enable targeted patient satisfaction improvement projects. Research shows that satisfaction surveys done at home and returned versus those completed prior to discharge elicit comparable results, but the latter are returned more frequently and are less expensive. They also provide more data for marginalized populations, like those who do not have reliable access to the internet or a permanent mailing address. Having this information would benefit informaticists by improving the quality of databases. Studies have shown that providers have adverse psychological effects if their communication skills do not meet the demands of their role, whereas effective skills increase the confidence of clinicians, lowers their anxiety, and raises satisfaction with their work. Therefore, technology infrastructure, training, and accountability for communication in these systems must be created to support our colleagues. Informaticists can garner information from research and other high-reliability organizations that operate in unpredictable and dynamic environments, where interactions are both complex and collaborative, with excessive amounts of data generated by all of the variables. Informaticists can design systems that transmit information effectively between parties and integrate lessons learned into new activities. This fosters a proactive communicative culture, which increases patient satisfaction and thus decreases risks for providers. Extrapolating from communication in the airline industry, informaticists can conduct future research in participatory leadership styles in primary care to elicit more proactive behaviors by patients. Informatics tech advancements have created more opportunities for electronic communication at the expense of face-to-face interactions. The loss of time together must be accounted and compensated for in the way we utilize technology. Doing so empowers patients, informaticists, and clinicians to achieve goals and directives with consideration of patient values, thus enhancing safety and overall satisfaction for all parties involved.
Created using Powtoon.